want to give you an update on the federal partnership with the state on our mass vaccination site at Cleveland State University at the Wolstein Center. We're now in our 4th week of operation. This is an 8-week program, and so the 4th, 5th, and 6th weeks that we are in right now are second doses. So just remind everyone, if you got a first dose, look at your card that they gave you that day. Make sure you go back and get that second dose. So these 3 weeks that we're in right now will cover the second doses. In addition to that, the 7th week and the 8th week, we still plan to use Johnson & Johnson to vaccinate individuals, and those will be for both weeks, of course, first and only doses, one dose for the Johnson & Johnson. It has run exceedingly well. We have a time-lapse video from our local partners in Cuyahoga County to show you that progress. Eric, thank you very much for running that. What's unique about this particular operation, and Fran, I've traveled around the state. We've been to 29 different vaccination sites around the state. Each one's different, but each one is unique. Each one is people coming together to do a phenomenal job. My understanding is there's no other FEMA mass vaccination site in the country that does it this way. We're using a stationary patient model. Citizens come in, they take their seat. Those administering the shots go straight down the aisle and go to them. They vaccinate around 500 people every single hour. So it's quite an operation to see. It's been very efficient. It's truly an amazing feat. I want to express my appreciation to FEMA. I want to express my appreciation to the Department of Defense, the Ohio National Guard, certainly Cleveland State University, and all of our local partners who have really worked so very, very hard to make this work. We appreciate that very much. Again, as we head into this week back to the Wolstein Center, we're in the week of second doses. We again would remind everyone to please make sure they get those second doses. There are many other locations across the state offering vaccinations. We're at about 1,300, and that does not include the different mass vaccination sites. So many sites across the state. You can visit Get the Shot, coronavirus.ohio.gov. Again, that's gettheshot.coronavirus.ohio.gov to look for open appointments at other mass vaccination clinics or at one of Ohio's 1,300 local providers. You can also call 833-427-5634 for scheduling help. Someone would help you schedule. 833-427-5634 for scheduling help. This week marks the second week that vaccine eligibility in Ohio has been open to all Ohioans 16 years of age and older. As we look towards next week, our administration is continuing our efforts to closely monitor vaccine allocations, make changes, make adjustments as necessary, and continue initiatives to help keep uptake of the vaccine high, which is what we really need to continue our battle against COVID-19. We found, for example, this week we had some of the health departments who said, don't send us any. We still have some from last week. We appreciate knowing that. We want to make sure these vaccines do not sit. So we're reallocating some of these to other places where the demand is certainly higher. I want to talk about 3 other ways today about how we can increase vaccinations, and it really is taking the vaccinations to people and making it even more convenient. Beginning this coming Monday, our providers may partner with other organizations to hold closed pod vaccination clinics with those organizations. For example, it might be a church, it might be a labor union, it might be a business who wants to vaccinate their members in one location or two or three locations, depending on if it's a company that has maybe different locations. And so that partnering can start on Monday. And we know there's a real desire to do that. I've got calls myself, so I know many businesses and labor unions and others are interested in doing that. So we have really encouraged people to do this. A couple examples, Nestle, with locations in Northeast Ohio, Central Ohio, and Southwest Ohio, has partnered with Discount Drug Mart to provide vaccinations for their employees at these different facilities. GE Aviation in Cincinnati area has also partnered with the local health system to provide vaccines for its employees. So many examples of that. We also know that vaccine providers themselves are making plans to vaccinate their own employees, and some have already started. So it might be the local pharmacy that's vaccinating their own employees. It might be Kroger that's vaccinating their thousands and thousands of employees across the state. So we continue to encourage employers and other organizations to reach out to your local health department and vaccine providers to set up these vaccination clinics. Also, vaccine providers, local health departments, we ask them to be proactive and reach out to your local employers. In fact, in the counties where we have seen the demand maybe go down a little bit, we really have encouraged the health departments to go out and reach out to employers in their community so we can continue to get shots in arms. These clinics that are being put together will make a big difference in helping us get more Ohioans vaccinated. We will add, we're in the process of surveying all 1,300 providers and asking them which ones want to be considered to partner with companies or other entities that might want to do a closed pod. And so once we get the results back, we'll make that, we'll publish that, and that will be available so employers will know who in their area, what provider might be interested in doing this. Second, we continue to encourage health departments to reach out to local high schools. We have 16, 17, 18 sometimes year-old young people who are in school, and we really would like to get as many of them vaccinated as possible. They obviously have to have a permission slip. Those who are 16, 17 have to have a permission slip from their parents. But we're already seeing this start to happen. A great example of this was the Columbus Public Health Department and Nationwide Children's Hospital reaching out and coming together with two of our high schools in Worthington as well as in Westerville. And there are pictures in the paper the other day of those shots occurring. The third way we want to increase this. This week we began providing vaccinations to providers partnering with our public and private colleges, universities, in order to vaccinate students who want to get vaccinated. This will be a multi-week process. Many of our smaller, our liberal arts schools will have received all of their vaccine this week, and they will, we hope, get those shots in arms. And so that's moving along very, very, very well. Some of our bigger schools, it will take multiple weeks, obviously, to be able to vaccinate all the students in their student body who want to get vaccinated. So again, we encourage our students to take advantage of this opportunity. Talk a minute about demand. As I previously stated, we continue to closely monitor demand for the vaccine as we make allocations across Ohio. We make the allocations every Thursday. We find out on Tuesday what's coming into Ohio, what the federal government's going to give us. Then we make the allocation, basically shipping orders back to the federal government, go back on Thursday. So we've been able to adjust vaccination allocations where demand has lessened. Some of these have shifted to our mass vaccination sites and our population centers, as well as our mobile clinic efforts. Others have shifted to northern Ohio areas which have both high demand and concern with spread of the virus variants. This week, just as an example, we were able to allocate 5,000 additional doses each to Lucas County and to Cuyahoga County for distribution through local providers. These additional doses were on top of the amounts allocated through our normal county formula. Franklin County, for example, we were able to allocate more than 1,100 additional doses to the Nationwide Children's Hospital for distribution. We've also directed our team to continue to look at ways we can encourage partnerships to distribute more vaccines and to adjust nimbly to changes that we see in demand. So we're going to monitor this every week, and we'll continue to make the changes that are needed.